Right now, the Senate is working on a bill which could majorly change the landscape for a lot of programs for the poor, like food assistance and Medicaid. Today, Quad City nonprofits got together to talk about what the cuts could mean for everyone in the QCA. KWQC's Kayla Page was there and broke it all down.
When federal budgets shift, lives have the ability to change. At today's roundtable, local nonprofit leaders spoke more about the impact of possible federal funding cuts and how it has the ability to impact things like food, housing, and Medicare. Let's start with food. Riverbend Food Bank CEO Chris Ford says if what's in the bill now goes through, those who use SNAP or food assistance could get less money for groceries. And the impact of these possible cuts is shown in the numbers.
Every $1 that's spent in a grocery store, 20 cents of that comes from the American farmer.
Now to health care, specifically Medicaid and Medicare. Community health care is bracing for cuts and is worried about people on these programs getting basic health care services.
It's a challenge right now. Everything we do is essential. And so, we do primary care. So if you want to go to a doctor's office, that's what we're here to do. Or you go to a dentist's office, or you need medication from a pharmacy. Those are the types of services we provide.
Now let's move on to housing. The Quad City nonprofits say if there are cuts to food programs and health care, people will have to pay more for food and medical treatments. So they say housing bills may go by the wayside.
Housing is healthcare, housing is mental health, housing is suicide prevention, housing is education, because you've got to have a baseline, someplace to lay your head if you want to address all those issues.
Now these local leaders say that their hope is that this bill doesn't quite make it to the president's desk by the July 4th deadline to be signed, but instead to continue the conversation to find a different resolution. In Davenport, Kayla Page, KWQC, TV6 News.
Overall, the proposal includes $800 billion in cuts to Medicaid, at least $200 billion in cuts to SNAP.